Hey guys, just wait a little minute for a few more people to show up. Okay, we'll just wait one more minute. I'm just gonna run and grab a different pen. All right. Okay, everyone's up nice and early. Well, 5 of you are up nice and early on a spring day. All right, so today, what our plan is. So just to give you a rundown of what's going on and what the plan is. So I just sent a couple of assignments to you, and we're going to discuss the one assignment. So we've finished the circulation system, but I didn't want to give you a review sheet for that just yet. I wanted you to focus on your quiz. So most of you have dealt with that. However, we are almost done the cardiovascular system for one thing. So we'll be finished that next week. And then we'll move into the musculoskeletal system. So we're just about done. So that's almost one more credit under your belt. So just looking at the names on my list here, so far, all of you guys have gotten the credit for first aid, the credit for health services foundations, and you are all looking pretty good to be getting the credit for this one. So we're looking good for that. And then we'll move into musculoskeletal. And then the last one is the sports medicine and nutrition. That one, I actually was at the school yesterday for the first time in a long time, and there are some booklets that are sort of set out in the office. So what I'll do, because Mrs. Lasachuk's one who ordered them, is I'll ask her to put all the outstanding ones for the people who wrote on my survey that they didn't have a booklet. I'll ask her to put those in the office, and then I'll email each of you separately who don't have a booklet, and then you can pick that up from the school. So usually what happens with school pickup is you go to the school, then you call the school office to say that you're there, and then they take whatever you need outside the door and pass it to you that way. Okay, but I'll clarify that and when those booklets are in the office, because right now I saw 4 student booklets in the office waiting. I'm just not sure where the rest of them are, so I have to touch base with Mrs. Lasachuk. Okay, so what's coming up? Well, I sent you guys a circulation worksheet, review worksheet, so that's for the circulation notes. So the circulation review worksheet is going to be due Monday at noon. Monday, I will also open a circulation quiz. So that'll be our last quiz, like small quiz for this course. So we've written a quiz on heart. We've written a quiz. You just are in the process of writing a quiz on blood vessels and blood. There'll be one on circulation. I also sent you a project, and we're going to talk about that project today, where each of you is going to research a different cardiovascular condition. So I sent that through Google Classroom, but we're going to talk about it, and we're going to pick our topics today. So those that are here today get first pick at the topics for research, and that'll be due in a week. So you'll have that due for me in a week. And then the following Monday, after the circulation quiz, we'll write our final unit quiz for cardiovascular system. And then this one is over and we move into musculoskeletal. All right, so any questions about that timeline and what's coming up? I'll make sure all of this is posted in Google Classroom in my little summary for today as well. All right, actually, I forgot to ask you if you could hear me, so I sure hope that you can. So if you can just give me a yes or no that you can hear me, that would be awesome. Okay, perfect. All right, so let's just talk about the project, because the cardiovascular or the circulation review sheet, that one's pretty self-explanatory. It's just like the rest of the review sheets we've done. But I'm going to share the project with you, so just give me 1 second. And so like I said, I've already shared it on Google Classroom, but I want us to pick our topics. So let's just take a look at it. So I should have it open here for us. And I just want to discuss it so we can all take a look at what this project is and what the expectations are for it together. And again, like if you have questions about it, or if you're doing research on one of these conditions and you're having a really difficult time with it, please just email me so we can go through it together. This is not meant to increase your stress. It's just meant for us to understand at least one cardiovascular condition. It is in the program of studies that we understand different conditions. So let's just go through this step by step as far as what you're going to need to do here. All right. So you're going to research one of these conditions, and we'll pick those conditions in a minute here. You can complete the project in the following formats. So if you're comfortable with Google Slides, PowerPoint is fine as well. So Google Slides and PowerPoint is the same thing. I just know that everyone's got access to Google Slides, so that's fine. You can make a brochure. There's a lot of different add-ons for Google for brochures. Brochure is usually if we have like the stuff that you'd maybe read at the doctor's office or the pharmacy, where you have like a front page and then you open up and there's information on each third. So that's fine. Obviously you can't give me a beautifully folded brochure for this project. You'll have to just send it to me digitally, okay? A poster, so if you feel comfortable doing a poster, that's fine. You just have to take a picture of it so I can obviously see it because I can't take the paper. If you want to do a video, so if you want to just record yourself talking through it, that's fine too. And then if you want to just have a little fun with it and do it in the form of a newscast, you can do that. Again, the mark is based on you meeting the outcomes. It's not based on what medium that you choose to do your project in. So do something that is less stressful for yourself. And maybe you really like to be creative, and that's fine too. Some of you might be familiar with Prezi. So if you want to do your project in that format, Prezi, that's fine, okay? So I've given you a few formats here. If there's another format you'd like to use, just let me know. Prezi, I should have written on my list. Prezi is just fine. You can do that in that if you're familiar with it. If you're not, don't worry about it, okay? All right, so here's the conditions, and we'll come back to those conditions in a minute. I want to just scroll down and talk about what you need to have done. So there's basically 5 components here. They're each worth 4 marks, so the total is 24 marks for the project. So the first one is identify the signs and symptoms of the condition. These need to be written in your own words, okay? If there's signs or symptoms written or listed, so when you're researching this, you see this really science-y language, you need to define the terms. The word that I always use when I describe what I'm talking about is something called microcephaly. I know that microcephaly is not a word that's in your guys' vocabulary, okay? However, that is a description of a symptom, or sign rather. It's a description of a sign. So if you see that word, I don't want to just see you write it down and tell me that that's a sign. I want you to tell me what it means. So microcephaly means abnormally small head. And that's one that comes to mind because when the Zika virus was prominent in Brazil, that was a condition of the baby that was born affected by mother having Zika virus. All right, so define the terms if it's in a sciencey language. If it's increased redness of the skin, well, you don't have to define that. That's pretty self-explanatory. I know that you guys know increased in redness in skin, right? But if it's a sciencey word, I need you to define it because I need you to prove to me you know what that means, okay? At minimum, you should be giving me 4 signs and or symptoms of that condition, okay? All right, describe the cause of the cardiovascular condition. So a cause, when we think about cause, there's actually 2 parts to it. So a cause is why did it happen in the first place? The why could be something like it happened because of genetics. It could be that it happened because of someone taking a particular drug, right? So cause, why did it happen? And then the structures that are damaged that led to it, right? So there could be multiple causes. You just have to give me one cause for a condition. And then what's been damaged in that condition? Maybe it caused a heart valve to be damaged. Maybe it caused a blood vessel to be damaged, okay? So the cause, when you're describing the cause, must be written in your own words. So no cutting and pasting from the internet. And I don't want big paragraphs. Give me a couple small, concise sentences or point form. Okay. The volume of material is not important, right? The accuracy and quality of the material is what's important. All right, identify and describe the procedures and or technologies used to diagnose the cardiovascular condition. They must be written in your own words. So sometimes what will happen for cardiovascular condition is it's diagnosed by using a stethoscope to detect heart rate, or using a sphygmomanometer to measure blood pressure, or maybe it's diagnosed through MRI, or maybe it's diagnosed through ultrasound. So those are the technologies that are used. Um, and then there's procedures, right? Maybe a doctor does a physical exam and notices that there's a bulge somewhere in the body. Okay, so that's why I'm keeping this open. Procedures and or technologies, it could be something the doctor's doing in examining, or it could be a particular technology that's used. Depends on the condition. Okay. Identify and describe the therapy or therapies used to treat the condition. So remember, therapy is a treatment. The treatment could be something like the patient has to go to physiotherapy, to exercise their legs. The patient maybe has to take a certain type of medication that's going to, I don't know, reduce blood pressure, right? So you're identifying and describing, like, why are they doing that therapy? What is that doing for them? So you can't just say physiotherapy. That's an identification, but you're not telling me what it's doing. I don't mean that you have to tell me like a book long version of what a physiotherapist is doing, but they're getting exercise or massage on their leg in order to alleviate a blood clot, right? Tell me why that has to be done, right? They're taking a medication. Don't just say they're prescribed drugs. They're prescribed drugs that are going to do what, right? That's your description. What is the point of it? Okay. All right. Bullet 5 here, identify a body system that's not the cardiovascular system, right? So we're discussing cardiovascular systems that is negatively affected. So remember, we talked about the body systems earlier. So things like the muscle, so the muscular system, the skeletal system, the lymphatic system, the endocrine system, the respiratory system. So a body system that would be negatively affected by this condition, and then how it's affected, right? How is that system affected? And do this in your own words. And then 6, your project needs to include at least 4 relevant images, right? So you could have an image that's maybe about a person that has a particular symptom, and that shows up in an image. An image could be a cause. So maybe a cause, there's some damage in a valve of the heart. Well, you could show image of a heart that has damage in the valve. Maybe a technology, right? Maybe a stethoscope is used. Well, you could show an image of a stethoscope, right? A therapy. Maybe a therapy is medication. Show an image of medication. But they need to be relevant. They need to fit with your project, right? They need to fit with something like this. Okay. Um, you have to include a reference list, right? Because you didn't come up with this on your own. So a reference list is basically giving credit where credit is due. Now, I just finished my master's, and the reference site that I used all the time was this citation machine. Okay. Now, I'm going to give you a quick rundown of how this works, because in the past, you might have given reference lists that is just a list of all the URLs, all the websites, right? You want to go further than that, right? Because as we get further in high school and as you decide to do post secondary, you have to get better and better at doing references. And this site is awesome. Okay, it takes very little work on your part in order to do that. So I'm just going to demonstrate how this works, just to show you. So I'm going to just go to a different share here, and I'm going to share. Thought I opened this. I think I did. Yeah. Okay. And let's go to this. All right. So just on the chat, can you guys see the citation machine website that I'm at? Okay, I guess I need to open my chat in order to see where you're at here. Hold on a second. Okay. Okay. Perfect. All right. So all you have to do is get the URL, so get the website information. So if I'm going up here, I'm looking at diabetes. Okay, so this is the Canadian Diabetes website. So I'll use the URL, and this is. And again, this is something that you need to practice for when you get further into high school and when you get into post-secondary. So this is a really, really nice one. I have you linked, so my link goes specifically to APA, which is American Psychologists Association, but the APA format is commonly used for science, so that's why we're using that particular format. All right, the other thing about images, so we always want to cite our images. So I just want to, I'm going to just go to, I'll look up an image. So let's say heart attack. Okay. And I just want images, so I'm going to click on images here. All right, so I get an image. But the thing is, I can't just cite that I went to google.ca or Google Images, because someone should be able to click on that link and go exactly back to the images. So what you're going to do in order to cite your images, so let's say this is the one I want, okay? So I can cut and paste this, right? I can right click and cut and paste this into my project. But to get the website that it comes from, click on the image. And here's my website. And now I just take that image or take that URL and I cut and paste that back into that citation program. Okay. All right. So that's that part of it. So I'm just going to go back to the project here. So let's go back to that. All right, so now we just go to the bottom part here. Here's a note. The projects will be shared with your classmates. What I'm going to do is share these because I want everyone, and I may not share all the projects, and I'm not going to share the ones that are done late or anything, but the curricular outcome says we need to know different cardiovascular conditions, and it's really nice for everyone to have an opportunity to see the different types of cardiovascular conditions and what they lead to and what they're caused by. If you absolutely do not want me to share your project, let me know, okay? And I won't, but I would like to have everyone have that opportunity in order to see that. All right, so this is due next Wednesday, so it's due a week from now. And first of all, before we get into picking our topics, are there any questions about what the expectations are for this? Okay, I'm not sure why I can't see my chat right now. That's weird. Okay. All right. If you do come up with a question, so if you start on it and again, something's really challenging or you can't find a certain part of the project, it just doesn't seem to be there, just give me a quick email and we'll go through that together. Okay. Again, this isn't meant to stress you out. The other note I want to give you is Wikipedia is really not the best place to find information because anyone can go on there and change or write whatever they want. So if you want to use that as your starting point, go to their reference list at the end and find that further information there. Okay, so find the information on there that they gathered their information from, and that's a way more accurate a way to deal with this. Okay, so let's pick our topics. Okay, so what I'm going to do here is go back up to where the topics are so we can all see what they are. I'll see if I can just make this a bit bigger so I can write on my screen. And where are we at here? There. And just open up who's here today. Okay, it's easy because there's not very many of you. All right. So I'm just going to open up my Google Classroom on my phone here. And where are we at? Just give me half a second for this to open. And then I'll just randomly pick you. So kind of look at that list, see if there's something that you're particularly interested in doing. And I'm just going to go to the people part here. I think my Wi-Fi is pretty slow today. All right. So let's start with boy, long list of people that aren't here. Let's start with Reese. You are the first name to come up. So is there a topic that you would like to research in particular, Reese? You can just type it into the chat or say it out loud, whatever's easiest for you. Okay, so Reese has Raynaud's. Okay, so we're going to cross that off our list for now. So Raynaud's disease is for Reese. Okay, so we're just going to take my little pen here and write Reese. Okay. Next person on my list here. Let's open this back up. Is Rodney. All right, Rodney. You can either type or say out loud. Which one would you like to do? Okay, atherosclerosis is Rodney's topic. Atherosclerosis. Just writing this down so I have a record. 1 second, my pen seems to stop working. Okay, it's Rodney. Okay, next on my list here. Better make sure I'm getting everybody that's on here. McKenna, you are next. Okay, Kawasaki goes to McKenna. Okay. Let's just gonna write this in shorthand here. All right. And okay, we have 4 more of you here. Our next person is Ethan. Vasculitis. Okay, vasculitis goes to Ethan. Just write a little E right here for now. And next person on our list is, oh, I thought, nope. Okay. Carly, you are next. Okay, cardiomyopathy. Cardiomyopathy. Carly. I'll just put a shorthand version of your name here. Well, that's really bad. My pen does not write well in here. Okay. And so we are just missing Jenny and Jason. So the next one here is Jenny. Pericarditis. Okay, and Jason, go for it. Okay, that's Jenny here. Coronary microvascular disease. Okay, microvascular disease. And that's Jason. Okay, perfect, guys. So again, if you have any issues with this or whatever, just send me an email. So we're going to end this now. So we've gone through what to do. We've gone through how to do your references. and you know that you have 2 assignments, and you will have a quiz on circulation that opens up on Monday. All right? Any questions before we sign off? All right, you guys have yourselves a wonderful day. Good luck working on this.